So today we're gonna start. We have finished the pulpitis and its types and its different type of pathologies. Today we will start periapical periodontitis, which we will do today. Okay. Basically, periapical periodontitis means on the region of the apex of the root there will be the inflammation of the pedial fibers, which is known as periodontitis. Okay, so basically it is called periapical periodontitis. Okay, so basically they are saying that there is the inflammation of the periapical area on the apex of the root, means the periapical area, but the inflammation of the pedial fibers, those pedial fibers which is present on the periapical region of the tooth. It is similar to that is occurring somewhere else in the body. Yes, you can say inflammation of anything. So this is the inflammation of the pedial fibers, but on the periapical area of the tooth. Now it is often accompanied by resorption of the bone. So very important point that when there is the inflammation of the pedial fibers, there will be the resorption of the bone at that area. Occasionally it is basically the root apex sufficient to be detected radiographically. You can see on the radiographically, okay, when there will be resorption in this, so that area will be blackish, means that will be more radiolucent, you will see in the radiographs. While it is convenient to describe the acute chronic periapical periodontitis as separate conditions, means you can say, of course, this is a chronic, which we have also studied in pulpitis. This is a chronic pulpitis and acute, as you also can say this is the chronic periapical periodontitis or acute periapical periodontitis. Basically it occurs when the tissues are irritated, so they do a response. As we have also seen the pulpitis, the pulp tissue was irritated, so the response was inflammation. Okay, basically. So it is also determined the this sequence is determined by the balance between the nature, like, and severity and duration of the erratin, again, and the integrity of the defense, that how the patient's defense system is. So when the patient has the periodontitis, so it leads to the periapical. So basically the sequel of pulpitis and periodontitis is similar. When patient has the pulpitis, it leads to the periapical periodontitis. Okay, you can see it. Patient has the dental caries. The dental caries cause the pulpitis. Now the pulpitis will cause the periapical periodontitis. Either it can be acute periapical, it can be acute pulpitis or chronic. Again it will lead to periapical periodontitis either will be acute or chronic. If it was if the periapical periodontitis was acute, so it will lead to the periapical abscess. Okay, so it will lead to periapical abscess. But if the periapical periodontitis was chronic, so it will lead to the periapic granuloma. We have studied it. Again, if it was the abscess, acute periapical abscess, yeah, chronic periapical granuloma, it will lead to the osteomyelitis actually at the end. Then osteomyelitis, in chronic periapical, what happens? The patient can have osteomyelitis or periapical cyst. After that, the patient can have the either then periostitis, it will lead to the bone, and then it will lead to cellulitis and abscess again. So this sequel of periodontitis and pulpitis is same, and one of the most important thing, patient will have pulpitis, then if the patient will have periapical periodontitis, very important. Again the periapical infection they have shows. Always remember that in chronic periapical there will be a granuloma and cyst. Okay, but in the acute periapical periodontitis there will be abscess, and that abscess then basically there will be on the level of granuloma there will be a periapical abscess. And then we have the Gary's osteomyelitis, cellulitis, and chronic osteomyelitis leading factor. So basically, the chronic and acute pathways, they have shown that if the infections are untreated, basically, so the depending on the proceeding pulpitis, which type of and the bacteria type, the presence or absence of the drainage will be occur. We have said that in acute pulpitis we don't do drainage, very important, okay, remember it. Again, what it shows, then the periapical, there will be inflammation, there is a pain, inflammation around periapical parts. In a chronic, there will be caries, so there will be a dead nerve. The nerve will be dead and the patient will don't have any pain. Very important point. In chronic periapical periodontitis, patient does not have any pain. When in acute, it has. And again, there will be a basically abscess or inflammation, and there will be a granuloma formation. What are the causes of the this? Again, pulpitis or pulp necrosis means the tissue is dead basically. If this condition was untreated, pulpitis is untreated, so the bacteria toxins will release and will cause inflammation that will lead down to the root canal, and then there will be periapical phenomena will cause periodontitis. Very important point. Patient has the periodontitis. This okay. Pulp necrosis follow other causes. For example, either the patient can have the blown to the tooth, the tooth is damaged, or damaged blood vessels, that is significant, that is clinically significant. Periodontitis does not develop unless the bacteria again. Okay, so basically, in pulp necrosis, the periodontitis does not occur until the bacteria does not reach to the necrotic pulp or periapical tissue. But in pulpitis, what happened? The pulp is inflamed, it reaches to the root canal, a periapical phenomena, and it forms periodontitis. When in pulp necrosis, that necrotic pulp should be invaded by the bacteria, so it will cause periodontitis. Number one, we have studied about this, which is one. Now moving towards Now moving towards another, which is a trauma. Trauma is either, for example, from anything, either from the fight or trauma. They have studied that occlusal trauma. Occlusal trauma means a patient has high restoration, means high marks are there. The restoration is not properly contoured. Okay. And the extra material has not been removed, so there are high spots. Undue pressure during orthodontic treatment, very important. During orthodontic treatment, there can be a trauma. A direct blow on the tooth, biting unexpectedly on hard body in food, means the biting can be in the form of trauma. The direct blown orthodontic treatment patient has high restorations. Traumatic periodontitis is often acute and transitory. Very important point. It can be, the traumatic is acute and transitory. It can transit then to chronic. Endodontic treatment, again, basically, then we have endodontic treatment. So mechanical instrumentation through the root apex during endo means any instrument that can damage the apex root. Sometimes, the like in RCT, what happened, that you have see that uh, gutta percha that can even cross that apex and damage the tissue sometimes. So it's very, you have to do very do the treatment very sensitive or very carefully. Okay. Chemical irritation from root filling means chemical irritation that some, as we all know, that some base and liners are acidic in nature. It can cause irritation. Instrumentation of an infected root canal may be followed by, means if there is an infected root canal, may be periapical inflammation as a result of bacteria when forcefully and unadvertently um, inadvertently into, means the bacteria will forcefully reach to the periapical tissue. So means any mechanical instrumentation when patient during RCT or during filling, that it can reach to the apex of root, cause damage, or any chemical irritation, either a baseliner from root filling materials or instrumentation of an infected, means when you're doing work in the infected tooth, so might be there an inflammation, by result the bacteria forcefully reach to the periapical, the bacteria reach there. So it may be also a failed endo treatment. You can see there is the bone absorption has been occurring in this. You can see, look at, the patient has done RCT. Basically, acute periapical periodontitis number 1 is an acute inflammatory exudate. Okay, so we always study acute, so always remember, in acute inflammation there is an exudate formation in the periapical, when in the pedial, within a confined space between the root apex or alveolar bone. Mean, if this is your tooth, right? So there is an inflammation means there is an inflammation on here. This is the pedial fibers, and the inflammation is here. This is the acute inflammatory exudate. So basically what you can see, there is an acute inflammatory exudate in the pedial fibers. The space is either it is the space is between the apex of root and alveolar bone. Okay, so the basically here will be inflammation between the apex of root and the alveolar bone. So you can say there, this is you can say this is acute. In acute there will be acute inflammatory exudate. Okay, yes, and that exudate will form in the pedial fibers that is confined between the apex of root and alveolar bone. Okay, clinical features, it has rapid onset. The pain is elicited when the extreme pressure. Okay, so it is very rapidly a rapid onset. Clinical features, the pain is elicited by external pressure when the external pressure from outside on the tooth is applied. ठीक है, or the pressure is even transmitted through the full or either the pain will either be caused by when some external source is external source being applied on the tooth, or either the fluid, that is the exudating fluid, will cause pressure on the accessory nerve endings and it will cause pain. Very important point. Okay, pus formation, definitely even the light touch may be sufficient to induce pain. So the pain can be elicited by the external pressure, either even the fluid exudate and the okay, or either by a very small touch, generally well located by the means it has well location. Patient can say that this tooth is affected of paining, particularly due to stimulation of proprioceptive nerve endings. Rapidus means the nerve endings are present in the pedial. So patient can generally locate this tooth. Okay, you can see here there is little bit, you can see there is a pedial fibers a little bit wide now. Okay, the tooth feels elevated. Okay, so in this patient, the tooth will become a little bit be elevated or raised from the socket. Hot constipation does not. Acha, very important point. In pulpitis, what we say, that hot and cold causes the pain, but here there is no cold stimulation or hot stimulation can cause pain.